many of the people that we just start with in supervision come at this with different ideas about and expectations about what supervision is. So that's where we're going to start. And so just a pretty general definition here of supervision. Supervision is a distinct intervention provided by an expressly trained and experienced member of a particular profession to a less experienced member or members of that same profession. Okay, so that's pretty simple and direct, but I want to highlight and illuminate some of the aspects of this definition because I think it really matters when we're talking about play therapy and supervision and the supervision of play therapists. Next is, these are some of the things that when we do provide supervision to people who provide supervision, which is an interesting thing to say and do, is these are some of the things that come up for supervisors. And so these are just some questions we wanted you to ponder. What do you struggle with as a supervisor? Where did you learn how to provide supervision? And what was your own supervision experience like? Okay, the reason why we choose these questions is because we find that this can become complicated in just doing supervision, but it really gets exacerbated in some ways with play therapy supervision. So what do you struggle with as a supervisor? These are this question for many people, the answer to it is similar to what kind of things you struggle with in counseling. Do you struggle with setting boundaries in counseling? Well, if that happens in your role as a clinician, that's probably going to happen in your role as a supervisor. So when your supervision session is 30 minutes long or an hour long, you have to hold to those same boundaries and parameters, just like you do with your clinical clients. One is we have to really expand the communication beyond the verbal, and that's just what we were talking about there. If we limit supervision to just verbal communication, we're not modeling, we're not teaching, and we're not really doing our jobs and doing justice to the whole concept of play therapy, again, that grounds us all together as play therapists.
Like, there's so much of your supervision also involves your supervisees work with the parents and caregivers and all of the other people in the child client's life. And sometimes those supervisions can be mostly about, I think most play therapists find the most difficult part of this work is working not with the child, but with the people involved in the child's life.